It's Friday, April 17th, 2020, and I'm standing on Market Street at what's supposed to be rush hour. The streets are completely empty. You can definitely tell that something crazy is going on right now here in San Francisco.
The coronavirus, which causes COVID-19.
The coronavirus continues to sweep Italy.
There are so many people dead.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
Stay at home, practice appropriate social distancing.
So we've been on lockdown here in California for about a month now, and probably like you and everyone else in the world, I am just trying to keep myself busy. I'm trying my hardest to stay motivated with at-home workouts. I'm going through my endless movie list. I'm reading a lot more, and I'm just not really seeing any friends or family that's around here. Our lockdown here in California might be different from yours. As of today, we can only leave home for essential activities like going to the grocery store, but it is our responsible obligation to stay at home as much as we can to continue slowing the spread of the virus here in the Bay Area. Most businesses have been closed. Some have really sadly and unfortunately shut down altogether. We are allowed to go outside and get some fresh air, some exercise. That means going on walks, runs, biking, so long as you are maintaining at least a 6 feet distance from other people around you. Our lockdown here is pretty low key, but our government is relying on us to be responsible about it. And so far, people here have been complying. They're taking social distancing measures very seriously. San Francisco's curve is low and flattening, but that doesn't mean this is anywhere close to being over.
Hello?
Hey, Nana.
Hi, Haley. How are you?
Good, I'm good. I'm just trying to get some work done. How are you doing?
Very well. Yeah, very well. It's a beautiful day out. Other than the fact that we're sheltered in place, everything's going well. Thank you, dear.
So I'm gonna make a grocery run, and I wanted you to give me your list of household items that you're going to need probably for the next, I would say probably 7 to 10 days of food and whatever else you need.
Oh, okay. Oh, this is so kind of you to do this for me, honey, because you know that I can't get out and do it. Mainly what I would like is fruits and vegetables.
The new coronavirus, at least what we know of it right now, causes mild or moderate symptoms for most people, but for some, especially older adults and people with existing health problems, it can cause more severe illness or death. This puts elderly people at high risk, so my family and I have been stringent on my Nana going out. Now that I'm fully out of my self-quarantine, I can do the shopping for her.
Now, don't laugh when I tell you this, but I need toilet paper, if you can find any in town.
Oh goodness, you're giving me this mission? This is gonna be the mission, Nana, to find you toilet paper.
Well, I really appreciate you doing this for me.
Oh, well, Nana, I wish I could see you soon. I hope I can see you soon.
Thank you, Haley.
Okay, I love you.
I love you too. Thank you, thank you, thank you.
Okay, you're welcome. Bye.
Bye-bye, dear.
I'm at Pier 39, the Fisherman's Wharf here, and this is one of the busiest tourist spots in San Francisco. These sidewalks are always packed, these streets are crowded. It's an absolute nightmare to park here. Typically you're walking shoulder to shoulder against people, and right now it is completely empty. There is not a soul in sight. So I just parked at Safeway. Under CDC guidelines, they're recommending that you wear masks in places that you may not be able to stand 6 feet apart from people. Here in San Francisco, all the grocery stores are pretty big, so it's not too difficult to keep your distance, but I am taking all of the precautions, gloves, I have my mask, and then I've got hand sanitizing wipes that I usually bring a couple in with me to wipe the cart down, and then also just to keep with me at all times.
Grocery stores have now limited their capacity, so there are lines to get into almost every grocery store here.
So they've got these decals on the floor now in all of the Safeways in the Bay Area. Some Safeways are one-way only down aisles. They are just reminding people to stay 2 carts away and continue practicing social distancing. So here's the tricky thing about getting vegetables. Usually you'd pick them up, look at them. I am being so hyper aware of what I'm touching, even though I have gloves. I am not going to rummage through the vegetables. I'm just gonna choose whichever one looks the best from right here. I just don't want to touch anything that is unnecessary.
We are also experiencing the coronavirus panic shopping, so as many of you probably know, toilet paper is hard to come by.
They've also installed plexiglass on all of the registers here. I just got back in my car. I haven't touched anything except my camera and the door handle, so I'm grabbing the sanitizing, just wiping everything down. So I was able to get most of the things on my Nana's list. The only thing that I'm missing is toilet paper. I suspect this is gonna be really difficult to find toilet paper. I'm gonna check another Safeway here. I feel like I should just Google what places in San Francisco have toilet paper. This doesn't really look promising. I just got into Safeway. It took about 35 minutes in line. Let's go see if they have toilet paper here. That is not toilet paper. This is a paper towel. And it looks like I struck out again. No toilet paper here. That was unsuccessful. I wonder how many stores it's gonna take to find toilet paper today. This is the new dystopia we are living in. For however long this lasts, weeks, months, we are just going to have to make the adjustments because our daily life is going to look so different for a long time.
At the time of this recording, there are over 2 million confirmed COVID-19 cases in the world, and almost 700,000 of them are in America. Earlier this week, I was able to talk to my friends who are nurses at the hospitals, just to get a sense of how they're feeling and what it's like on the front lines of this battle here in the Bay Area.
We are doing relatively fine here at the hospital. Actually, we are very lucky that our hospital hasn't been overwhelmed with the surge of COVID-19 patients like we've been hearing about New York and other states in America. I think this is largely due to how serious people in the Bay Area are actually social distancing. People here are being responsible about staying at home, which has helped reduce the surge of infection here.
In my hospital, I have been taking care directly of suspected and confirmed patients of COVID-19 cases, and so far we have seen low admissions because people here in the Bay Area are doing a great job of practicing social distancing. Since San Francisco went to a lockdown pretty early, we've been able to flatten the curve. We are, however, experiencing shortage of supplies and we've been reusing our masks, but the hospital is doing a great job supporting the staff, and also the community is really helping us a lot of supplying PPE donations.
I have the same health concerns as every frontliners around the world. We are afraid of getting infected because sometimes these patients appear asymptomatic. But the hospital is really doing an amazing job in making sure that everyone on the front line is protected at all costs.
My biggest concern is that when the government starts to lift the lockdown, there will be a second wave. And so right now, we are gearing up for that and we're training more nurses so we can be prepared when that happens.
I think what Arnan said is crucial to keep in mind, that this is not over and that there very well could be a second wave of outbreaks. We are all in this together. We need this distant solidarity together now more than ever. It's incredible to see the community coming together and supporting each other. For me personally, I'm taking things day by day. As a travel-centric content creator, I'm not expecting to travel anytime soon. So in the meantime, I'd like to ask you all, where are you in the world and how is your quarantine going? And how is yours different from mine? I hope you guys are all staying safe and healthy out there and taking care of all of your loved ones and your community. And I will see you on the next video.